Back in Orlando, Florida, we have done inside-out quantum for lower face rejuvenation and neck. We've done outside-in tissue contouring with the Morpheus N24 burst. Now, we're going to do filler and toxin. Heat, filler, toxin, suture, in that order. And so we're going to use a little bit of filler. There's many options. I prefer HA gel when I'm first getting to know patients. It's reversible if there's an embolic or intravascular accident. Make sure you use ultrasound and map out the facial artery, the transverse facial artery, the superior and inferior labial arteries, so you know where they are and stay away from them. If you've been doing it a long time and doing facelifts, you already know where they are, but avoid risky areas. And chin up just a bit there, young lady. Perfect. There we go. And we're going to use a gel. The gel I'm going to use here is a HA gel available all over the US. And because I'm patriotic, I'm using Prolenium, which is the only HA-approved gel in North America, actually made in North America, just outside of Toronto. So Toronto, Canada, Prolenium makes a good product. It's got a good milling process, tend not to get hypersensitivity nodules 4 or 6 months later. It lasts a good 9 months, and you're going to get it cheaper than Juvederm and Restylane and Toxin. But whatever gel you like and your pharmaceutical relationship, leverage that. Get the best possible price per syringe. They all work about the same, despite what the reps say. 0.1 of Lido, 0.9 of the actual HA gel, and so you don't have to dilute with lidocaine like we used to, and you go ahead and inject. So I'm going to use an injection strategy that uses a microcannula, 22 gauge, 2-inch microcannula. And we're going to use a little sharp needle to get under the skin, kind of like a port we use to get under the skin for the quantum. That was a tip of an 11 blade. I can use a 21 gauge to get under the skin for my cannula. If I was going to develop a device, if we show this, a zoom up on the skin, and you were to say to yourself, I wonder what I should use to draw an arterial blood gas. And you looked at the shape of the tips, and you wanted to get a nice arterial blood draw, you'll probably select the sharp needle to get into an artery. Probably not a blunt cannula. Now, with enough force, this will get into an artery and cause a problem, but this is likely probably more likely to have an intra-arterial penetration probability. No one ever proved that study, but I like cannulas because they're fast, less bruising, and I think less painful, and probably less likely to cause a problem than this kind of spear shape. And so we're going to use a retrograde, low-pressure linear technique to use volume under the eye and up the zygomatic arch. So I don't need supraorbital buttress. I'm going to use infraorbital and high zygomatic. I'm going to come down the nasojugular groove to the orbital malar groove. I'm going to pierce the skin right there. That will allow me to get right up to the infraorbital buttress and go side to side with my HA gel, then turn through the same port and do the high zygomatic arch with my 2-inch rigid dermosculpt microcannula, single port.